Hi, I'm Rachel from the Center for Suicide Prevention and Research at Nationwide Children's Hospital. It is important for all of us to understand the risk factors for suicide. While it is very difficult to predict whether a young person might become suicidal, paying attention to these critical risk factors is important when it comes to children and teens. The first risk factor is previous suicide attempts. We know that as the number of attempts for an individual increases, the risk of them dying from an attempt also increases. Next is untreated mental health disorders, like depression or bipolar disorder, as well as anxiety disorders, ADHD, or trauma. Using alcohol and drugs is also a risk factor. Substances can increase negative feelings, impulsive decision-making, and make it more difficult to think clearly. As a result, young people may take risks or act on suicidal thoughts without considering the long-term consequences. Most people who die by suicide exhibit one or more warning signs, either through what they say or what they do. As a parent or caregiver, you know your child best. This puts you in the unique position to identify significant changes in your child's mood or behavior. Warning signs are most concerning when they follow a recent painful event or experience. Warning signs you might hear include statements about attempting suicide or wanting to kill themselves. They may speak about this directly or indirectly. They may also express how they're feeling hopeless, worthless, or trapped. Or they may talk about having no reason to live or being in unbearable pain. A warning sign can also be saying goodbye or making contact that sounds final, like, if anything happens to me, I want you to remember me. Talking about death or a recent fascination with death is also a warning sign you might hear. You can also see warning signs, especially in their behavior and actions. For example, searching for items that can be used to kill themselves, like hoarding medication. Starting to use or increasing use of alcohol or drugs can also be a warning sign, as well as losing interest in personal appearance or hygiene. Dropping activities they once enjoyed, isolation, writing goodbye notes or giving away personal items, big changes in mood that get in the way of activities or relationships, reacting to situations with extreme frustration or anger. Or alternatively, sudden improvement in mood can also be a warning sign. This can indicate a sense of relief after deciding to make a suicide attempt. Also be aware of self-harming behavior. Even though this may not be related to suicidal thoughts, you should still follow up. There are some behaviors or warning signs that mean seek help immediately. These include talking about attempting suicide, planning a suicide attempt, or looking for ways to end their life. If you have observed any of these warning signs, connect the child with professional help immediately, such as the 988 Suicide and Crisis Lifeline, emergency medical services, or a mental health professional. Do not wait for a crisis to discuss suicide. Part of preventing suicide is being aware of mental health concerns before things become overwhelming. Check in regularly with your child using open-ended questions. Ask your child how they're doing at the dinner table, during car rides, or other times when you can talk one-on-one. Provide space to talk about their emotions. Allow your child to share whatever they are feeling and normalize all emotions. Ask about suicidal thoughts directly. You can ask, have you ever thought about ending your life? Or have you ever thought about killing yourself? These questions do not put thoughts of suicide into their head. Connect them with professional help if they are experiencing significant emotional concerns or if you are worried about their safety. Even if you do not have immediate concerns about your child's risk for suicide, talking to your child directly about it is important. Although this can be a difficult conversation to initiate, creating a safe space to talk about suicide can save a child's life.